This video demonstrates the figure-of-8 stump bandaging technique for individuals with below-knee amputation. The purpose of performing stump bandaging include edema management, shaping of the stump prior to conversion to a stump shrinker, and preparing the limb for prosthesis fitting. For this procedure, prepare the following items. Before starting, ensure privacy and comfort for the patient. Adjust the bed to a suitable height and ensure adequate lighting. Perform hand hygiene by either washing your hands or using an alcohol hand rub. For contact precaution cases, or if there is an open wound, always wear gloves and place the affected stump on a protective sheet. Identify the affected limb. Assess the stump for any redness, any presence of skin or wound breakdown, or excessive swelling. Check skin temperature changes using the back of your hand, starting from the far end and moving upwards towards the body. Hold the crepe bandage roll with the roll facing upward. This orientation allows for smooth application and controlled tension during wrapping. Begin wrapping the bandage from above the knee, going diagonally across the stump. Ensure that the bandage covers approximately 2/3 of the distal stump. Bring the bandage around the back of the stump to behind the knee, and then bring it diagonally across the front of the stump to above the knee. Continue wrapping the stump in a figure-of-8 pattern, moving diagonally from the bottom of the stump and moving upward. The tension applied at the bottom end of the stump should be the greatest. Overlap each layer by 2/3 to half its width to cover all exposed areas and create a conical shape. Gradually reduce tension while wrapping upwards to ensure effective compression without causing discomfort. Continue with the figure-of-8 pattern until the entire stump is completely covered. Secure the crepe bandage with micropore tape. Avoid using safety pins or clips as they may cause patient injury. Proper below-knee stump bandaging creates optimal graded pressure that reduces swelling, prevents bandage slippage, promotes wound healing, and shapes the stump for future prosthetic fitting. Check that the bandage is firm but not constricting. You should be able to slide one finger into the bandage. If this is not possible, the bandage is too tight. And if the finger slides in too easily, the bandage is too loose. Ensure each layer of the bandage is smooth and flat, without wrinkles or creases, as these can cause uneven pressure and skin irritation. Proper bandaging technique is crucial for effective care. Improper bandaging techniques can lead to several problems. Firstly, uneven distribution of pressure can damage underlying tissues and delay healing, resulting in poor limb shaping. Secondly, excessive tightness over the upper end can compromise blood circulation. Perform hand hygiene by washing your hands or using an alcohol hand rub. For nurses, document the following in the nursing notes: condition of the stump and surrounding skin, any dressings applied, the patient's tolerance to the procedure, and details of any patient education provided. For patients and caregivers, please take a photograph for review at the next consultation. Additionally, assess the patient and stump at least once per shift, paying particular attention to any tingling, throbbing, or other abnormal sensations. Regularly evaluate the integrity of the bandaging, checking for signs of loosening, slipping, or soiling. Monitor for any fever or lethargy and assess the amputation site for signs of infection. This includes severe pain, redness, warmth, and swelling. There may be an increase in wound discharge and presence of foul smell. Report any significant changes to the doctor immediately. For any enquiries, please contact the respective team for assistance.